This week on the Mama podcast, Heidi sits down with Dr. Kirsty Harris from Northamptonshire Perinatal Mental Health Services. Dr. Harris shares the incredible work her team is doing to support parents who are pregnant after loss, from helping manage anxiety and trauma to offering specialist midwife support and group therapy sessions designed to build coping skills and hope for the months ahead. Join us as we explore what support can look like when it's truly tailored to families' needs.
Thank you for joining us for this episode of the Mama podcast. I'm your host, Heidi Eldridge, the CEO and founder of Mama Academy. And we are joined by Dr. Kirsty Harris. Thank you so much for joining us today, Kirsty. I can't wait to hear all about you, your team, and the role at your trust. So please introduce yourself to everybody.
Yeah, thank you so much for having me. So I'm Kirsty Harris. I'm a consultant clinical psychologist in Northamptonshire, and I work across a perinatal mental health team and a maternal loss psychology service in our county. So I grew up in Northamptonshire, been here more or less my whole life with a couple of brief escapes for universities and things. But it's my hometown and I love living here. Not everybody says that, but I do. And I love working here as well. So I've been in NHFT, which is our trust here in Northampton, since I finished my doctoral training in 2014. And I was a trainee here before that. So well over 10 years in the trust, which probably speaks for itself in how I find it and things. Really enjoy working here. And then I suppose I was going to tell you a bit about the teams and what I do. Everybody always says, well, what do you do on a day-to-day basis? So working across two teams, I think you're quite busy. I know I'm quite busy, but it's really, really diverse work, which is fantastic. I think keeps me really passionate about what I do. So we've got the perinatal mental health team, which you'll see all over the country now in different areas. And I lead the psychology team within that service. We're a very well-resourced team in Northamptonshire, thanks to the support of lots of colleagues along the years of really investing in psychological interventions for perinatal women and birthing people. So in that service, we see about 300 to 400 women a year for psychology. And we do a range of things, including groups, one-to-one, all of those things. And then the maternal loss service, which is what I'm going to be talking about today, is much smaller service. There's a handful of staff in that team. So myself as a clinical psychologist, part-time, senior psychological therapist, an assistant psychologist, and we've got two specialist midwives. All of those staff are part-time, so there's more bodies than there are hours, but really, really lovely team. We've been working together for a few years. 7 years in perinatal this year I've done, and slightly less in maternal, so this will be my 7th year. I'd never really thought about it before. Like when I was on training, I think we had one session on perinatal mental health. It wasn't something that was really dominant when I trained, but very quickly become aware of the importance of those early attachment relationships and what it means to become a mum or a parent. And I was working in inpatient services then, and again would see lots of people where their early childhood experiences had been quite difficult. They might have experienced quite a lot of adverse childhood experiences. And I thought, actually, maybe there's something about trying to prevent this, trying to work with people much earlier on. And then perinatal started to get talked about, get commissioned. So Northampton was a wave 2 site, so we were a bit later than the rest of the country. But I sort of saw this job coming and was thinking, I really want to do that job, and thought that my skills would help I became a mum myself in 2015, so a couple of years before I took the job. And that did influence my decision. I think, personally, I started thinking, yeah, I can really see the links here. I can see how psychological skills and thinking and training is really relevant in parenting. I'm also really passionate about women's health in general. I had endometriosis myself, so I was really passionate about that kind of area. And this job just seemed to marry together all of that experience. And I was, I suppose, fortunate enough to get it, and have stayed here ever since, just building on different things year on year on year.
Wow, well, it sounds like it's a perfect fit for you. It sounds like you're the perfect candidate for the job, and you've been doing it, such a long time now. Have you got any interesting facts specifically about your trust and the services that you offer for maternal loss?
So I suppose the trust, we're a foundation trust, which is slightly different to some other trusts. So we became a foundation trust in 2009. And I think the trust really does pride itself on delivering outstanding compassionate care to people in the county. The trust will talk a lot about people first, and thinking about how we take care of the communities that we serve. And you'll see our strategy on my background if you're watching us, about all what we do. And I think our hard work is reflected in our CQC rating. So we're rated an outstanding trust, which we're very, very proud of. And I think you feel that as a member of staff here as you're trying to develop our services. So across our county, the trust as a whole is looking after about 785,000 people, which is obviously enormous. We've got, hundreds of services and thousands of staff delivering that work. Perinatal mental health and maternal loss are little parts of that, but obviously parts that we're very proud of. So we, like I say, perinatal mental health we were what they called a wave 2 site, so we were a bit later than other parts of the country. So when you say, oh, you've been doing job a long time, like 7 years to me in perinatal feels very small, actually, like there's still lots to do, but that's a good thing. So we look after in perinatal around 900 women locally. That's what we're commissioned to do. But we work really closely with other services in the third sector for women who might need help beyond our services, and for birthing people as well. But our remit is moderate to severe perinatal mental health difficulties in the perinatal mental health team. So that's who we would see. As maternal loss came later, and we're commissioned for about 100 women and birthing people a year. So again, it's a specialism within a specialism. And we're looking after people who are experiencing mental health difficulties such as depression, anxiety, PTSD, complex grief, following perinatal and maternal loss, which we're going to talk a bit more about, I think. But in both services, we're focusing on psychological intervention. So what colloquially would be called therapy, offering therapy and psychological intervention to these groups of people. And in the maternal loss service, we've got both what we call pregnancy after loss pathway, people who are currently pregnant and have had a loss in the past. And we also have a pathway for people who've experienced a loss in the past year, and might need support with that. We've got 2 strands to what we do.
Okay, it sounds brilliant. And I know that your maternal mental health service was one of 10 early implemented sites. So how did you develop the service specifically for your region?
So when I started working in perinatal, like I say, I had my daughter. My daughter was about 2, and I was starting to obviously kind of expand my knowledge of this whole new world of being a parent and what that meant, and fertility journeys and all of these things. And I also obviously was at an age where a lot of my friends and my peers and my colleagues were starting to explore that too. So I was starting to gather, I suppose, a lot of knowledge personally from people around me who were undergoing this part of their journey, part of their life, and having a huge range of experiences related to that. I think sometimes we go in to our adulthood, our transition to parenthood, sort of thinking that we'll decide to have a baby and then we'll do all the actions that are necessary to make that happen, and a baby will appear at the end of it. And if that isn't your experience, then that can actually be quite surprising. Even though we might know that that could be the outcome, nobody goes into it expecting that to be the outcome. So I was starting to sort of experience that personally in people around me and people I know. And also then in my perinatal work, starting to experience working with people whose pregnancies were ending in loss. And that might have been through stillbirth or miscarriage or termination for medical reasons, but they weren't coming out at the end of this journey with a live baby. And that was new for me. It was also new for us as a service. Like when we originally set up our perinatal service, we hadn't really written a policy around what would happen if somebody's baby was stillborn. And we were having to work that out as we went along. And very quickly, we started to learn that there wasn't a lot of support where we are in Northamptonshire. Different parts of the country are all different, and some places have different third sector organisations. We have a SAND service here, which offers quite a lot of support, and we have some other charitable services. But in terms of what was available in the NHS, and particularly available for people who were really struggling with this, we started to notice these gaps. I started to speak to other services in the NHS, for example, our NHS Talking Therapist service, sometimes called a IAP team in other parts of the country. And I started speaking to a colleague who'd also got some cases of women who had experienced losses, and they needed something beyond what her service could offer, but they didn't meet criteria for a perinatal team, because for a perinatal team, you have to have a baby. So if your baby has passed away, you're not going to be seen by that service, or you're not pregnant anymore. We also had people who'd been under our team when they were pregnant, and then when their baby passed away, we weren't able to offer intervention longer term. We had to work with other services to build an intervention that they could access in a different team. And we worked so hard to do that as well as we possibly could, but we thought it could be better. That's where maternal loss came in. So the colleague that I actually was talking to in NHS Talking Therapy has gone on to work with us. So she and I now form part of the maternal loss team, and we were really, really passionate to make this happen, make these services exist, particularly with a focus on grief. Because again, a lot of services are not focusing on grief as a component of the work. So we put in our bid and went through all the things that you have to go through to commission these services, and we were selected to be one of 10. And what that meant was they chose 10 services that were all trying slightly different models and slightly different things, so that they could then think across the country, what's worked, what hasn't, how can we roll this out in other places. So for us, we focused on, at that time, perinatal loss and birth trauma. So where women have had a previous traumatic birth and then might be experiencing PTSD in a new pregnancy, because they were the gaps, and that was what we thought we could fill with our service, with the resource that was being offered as part of this commissioning. And that's what we started with.
And I know that it was renamed from the Maternal Mental Health Service to Maternal Loss Psychology Service. So why was that?
Yeah, so that kind of partly was because we started with a broader remit. So we started with birth trauma and perinatal loss and maternal loss. And that fell under Maternal Mental Health Service. It was also what they called it in the commissioning. That's what you bid for. So there's services all over the country that were called maternal mental health services. Initially, they were all called the same thing. So we went with that initially. But what we found was we were seeing too many women, too many birthing people for the capacity of the service. Very, very quickly, running both a birth trauma and a loss pathway meant that there was a lot of people that needed that support. And also we weren't seeing some of the people that we expected to, and we weren't quite sure why. So we made this decision to move our birth trauma pathway into our perinatal team. And I've got some colleagues in psychology team who now lead that pathway and do an outstanding job of offering this specialist intervention for people who've experienced traumatic birth and are currently pregnant. So that service still exists and that support still exists. It just moved over into the perinatal team. But that then,
okay.
yeah, so it was kind of it needed to happen, and sometimes it can be confusing, but the point is it's still there. But we moved it over into a service that could offer that. So that continues. But if you were coming to us for birth trauma support, you'd realise that you're going to sit in the perinatal team for that support. And what it allowed then the maternal team to do was actually focus in on what we felt was really important and what was still emerging as a gap, which was loss. We still weren't getting lots of loss referrals at that time. So we decided that we were going to meet with some families to find out why. So families who had experienced loss. So we worked really closely with bereavement midwives across both of our hospitals, and we were able to speak to both families who had accessed us, but also some families that declined a referral, who the bereavement midwives thought would have benefited from seeing us. And the feedback we got was it was the name. It was because it was called a maternal mental health service. And they didn't see losing a child, losing a baby as a mental health issue. So there was an ongoing stigma around mental health and not wanting to access a mental health team and not wanting their experience to be labelled as a mental health issue that prevented some people from accepting a referral to the service. And the other thing is people didn't know what it was. So when you say maternal mental health service, what does that mean? What are you going to get from coming there? You know, if you're going for an X-ray, you know what that is and what the outcome of that might be. You might have something broken, you might not, and then you can make a guess as to what the treatment's going to be from there. But the name maternal mental health service didn't mean anything to people. So we decided to try and come up with a name that really accurately reflected what it is that we do. So with these families, we decided to call it the Maternal Loss Psychology Service, because we support people who've experienced maternal loss and we offer psychological therapy. So we felt that more accurately showed what it was we do. And the terms get used interchangeably, maternal loss and perinatal loss. And you'll hear me do that probably as we're speaking, and you'll have seen it in all sorts of places, probably other podcasts as well. Perinatal, actually, a lot of people in general public are not familiar with that as a term. They don't really know what that means. And I can see you're shaking your head now.
Well, I try not to use it as much as I can because I know that it doesn't translate with parents, that it's not a word that parents would use.
Yeah, whereas obviously in the NHS, perinatal is the way that everything's commissioned, so we use that all the time in NHS services. But actually, you're right, parents don't recognise that term. So we went for maternal loss, but they get used interchangeably, which really is about the emotional and psychological impact for parents after losing a pregnancy or losing a child. And in our service, that would include a whole range of different experiences: miscarriage, ectopic pregnancy, molar pregnancy, termination for medical reasons, neonatal loss, stillbirth, and sometimes complex fertility journeys as well. So we're covering a huge range, and it just felt like renaming the service would allow people to access it, understand what it was for, and hopefully help them to see that there is something for them across a whole range of experiences. And that seemed to work because the referrals went up and people are understanding what it is we do.
Interesting. Such a small change of changing the name can make such a difference.
Yeah.
Tell us about the pregnancy after loss service, because you spoke about that at the maternal mental health conference that we went to in London, and I was just blown away at what a fabulous service you're providing so many people with. So tell us about that service.
Yeah, so that sits within the maternal loss service. So there's two pathways. One is for people who are currently pregnant, and one is for people who have recently experienced loss. So what we noticed is that when people fall pregnant and they've had a loss in the past, they often feel increased anxiety. They often notice perhaps a worsening or a re-emergence of any symptoms of trauma that they might have that might be related to their loss in the past. And for some people, it impacts their mood as well. And this does seem to be quite specific to women and birthing people who have had a loss in the past. So there was very obviously a need for women during their pregnancies to be supported through this. And what we came up with was a set of group offerings. So as I said, we've got psychological therapists and specialist midwives. So there's a specialist maternal midwife in each one of our local hospitals that work with our team. And we work really, really closely together. So if you were to come to us and you're pregnant and you'd had loss in the past, and we're going to assume that you're perhaps very anxious, and you might perhaps be experiencing some symptoms of trauma. So we would then be meeting with you, offering you an assessment. You'd meet with the midwives. They would offer you an appointment to kind of talk about any specific worries you've got related to your pregnancy. The midwives will also support you through things like scans, which cause a lot of anxiety, making sure we offer something called an antenatal passport. So that is a little kind of document that you put with your green notes. And on that, it will tell the people that you're seeing the key things they need to know about you. So you can give that at the beginning of the appointment. So we're trying to avoid things like, oh, is this your first? And the general things that get said that actually can be really, really distressing for some of our families. So they can give this little, it's just one sheet of A4. We use a combination of images and brief bullet points just to tell whoever it is, be it a sonographer or a GP or another healthcare professional, just the key things that this person needs them to know and needs them to say. And the midwives will liaise with all of those people and departments to make sure that they know, oh, this family's coming in today, and this is their experience. So can you be aware of that when you're doing the scan, or whatever it is? So the midwife will meet with you, and then we offer two different groups. One is a maternal trauma antenatal resource course. So that's a CBT-based trauma stabilisation intervention. And that is about 6 sessions. They run online because people find it easier to access. Often people are still working and things, so they run online. And we're focusing on grief reactions, understanding what grief can look like after perinatal loss, what it can look like in a pregnancy, understanding traumatic grief, understanding bereavement-related depression, understanding trauma and what that looks like in a pregnancy and how this can be activated. And developing coping skills. The main thing is to help people to develop some different ways of coping, because 9 months is a long time for a pregnancy for anyone. And if you are particularly anxious, find it particularly stressful, it can feel even longer. And there's lots and lots of milestones to get to and overcome. Often when people come into our service, they say, when I get to, there's a X week,
Yeah.
when I get to 12 weeks, I think I'll be all right. When I get to 20 weeks, when I get to, and sometimes they might find that there's a change in their anxiety around that time, but it often isn't a complete resolution as they perhaps expected it to be. So actually they need ways of managing throughout a pregnancy that are realistic for somebody who is pregnant. And going through these things that they can actually use, and that we work with the systems around them to support them to use those techniques. So it might be this lady really benefits from having some quiet space And how can we facilitate that? Can we make it so that they don't have to wait in the waiting area? They can wait somewhere else. They can have that quiet time. And the woman then is thinking, well, I know I can do my breathing in this space, or I can do this exercise in this space while I'm waiting. And we kind of try and join everything together, because what we can't do is wave the magic wand that guarantees that everything is going to be all right for everybody. So we're actually working within that uncertainty. And I think that is the biggest difference with this work, is that you're working within uncertainty all of the time and helping families to work within that uncertainty. So you can have that group. And then there's also a pregnancy after loss midwifery group that runs alongside that. That's 3 sessions, four. And people can kind of opt in and out of that. And the pregnancy after loss midwifery support focuses much more specifically on pregnancy related concerns. Lots of letters that you get during pregnancy, if you've had a loss, are quite scary. Sometimes the wording is really activating. If you get perhaps any complexities in your pregnancy, gestational diabetes as an example, or anything else, you get a letter about this can raise anxiety. So the midwifery group is specifically about, what if you do get diagnosed gestational diabetes? What is the test for that? How does that work? What impact might that have on you and your baby? What is each scan for? What are they looking for? Like, if they take a scan and then tell you to go away and come back, why might that be? So that you're not left guessing, because in busy NHS services, sometimes the explanations are what's missing. And it's not because people don't know or don't care, but there just isn't always the time to go into the level of detail that our families want and need. So this group allows that to happen. And then we've also added in a group for fathers and partners and non-birthing parents, which I'll probably come back to.
Sounds absolutely fantastic. I'm just wondering, when you first set that service up, whether you encountered any challenges.
Yeah, I mean, there was a lot of challenges. I mean, one was obviously that it was all new. And we were trying to work out what to do. And not only was it new, as in maternal services were new, and even perinatal work still quite new in the scheme of sort of the NHS and how long other services have been going. But we were early implementers, so it was kind of our job to be finding out, for the benefit of the rest of the country, how this was going to work. And it was a specialism within a specialism. So for me, I'd gone from what I was doing before in inpatient services and adult mental health into perinatal, which is a specialism, and then you're going into a specialism within that, and then there's bits within that as well. So that was a challenge, that we felt a little bit like we were making the best guess on what would work. Also, groups tend to be initially unpopular in any service. So in any adult mental health service, if the first thing you're offered is a group, a lot of people will say, I'd prefer not to do a group. And I completely understand why. Lots of us have anxieties about being in a group, the way that group therapy might be portrayed on social media, what you're expecting that to be like, often led to people initially saying, I don't want to do a group. But the challenge of that is, if we didn't do a group, then we weren't going to be able to offer everybody who came to us an intervention. So if we'd have carried on that, if you were pregnant and you came to see us and we were offering one-to-one, you would have gone on a wait list, and we wouldn't have been able to guarantee that you would have reached the top of that wait list during your pregnancy, particularly when pregnancies, all sorts of things happen. You don't all have your baby on your due date. Sometimes babies are early, sometimes babies are late, all sorts of things happen. So we just knew we wouldn't be able to see everyone and offer them anything. And we felt like that was worse than offering a group. But we were most concerned about being sensitive to the families that we cared for. And our main anxiety was about, how are people going to feel being in a mixed group? Because we looked at, do we offer a group for people who've experienced a miscarriage, people who've experienced a stillbirth, people who've experienced a neonatal death, people who've experienced something, all of these different experiences. But that wasn't going to work either, because we didn't see that many women, and they might not all be pregnant at the same time, because you've got to have at least 4 to 6 women who are all pregnant at the same time, who can all attend this group. That in itself is a challenge. And then if you add in, and we're trying to then have only women who've experienced miscarriage, or only women who've experienced, then it's not a group, because fortunately we've not got enough numbers for that. So the only way it was going to work was for it to be a mixed group, and the definition to be that you had experienced a maternal loss. But that might be a miscarriage at 4 weeks, 6 weeks, or it might be a term stillbirth with no warning at all. And those experiences are different. They are different, and they do present differently in another pregnancy. So we were really concerned that if we brought these people together in a group, that it might be difficult for them to share their experience. It might be difficult for them to relate to each other. It might be almost concerning for some people if they'd had an early miscarriage and they were in a group with somebody who experienced a stillbirth, that they might actually become more anxious because of wondering whether that experience was going to be their experience this time, which we see with people using social media and things, reading lots of experiences. So we just were concerned. So again, we went back to our families and women that we'd worked with and people that we'd worked with, and said, look, this is the rationale, because it's either going to be that some people won't get anything, or we try this. So how can we make this work? Can we make it work for people? And actually they said, yeah, we think you can, if these things are put in place. So things like being really clear with people at the outset what this is, and that there are a mix of people in the group, so they know that. Being really clear that the aim of the group is to focus on what's happening in this pregnancy, and actually that experience often is shared. So even if you had whatever your previous maternal loss was, chances are you're more anxious in this pregnancy and more worried about what's going to happen. It's harder to talk to people about it. When people are really excited for you, you don't share the excitement in the way that you want to, or the way that they do. Those experiences often are shared in a subsequent pregnancy, so that we're focusing on that. Giving them options for like support if they need it, letting them answer their questions. Everybody gets a one-to-one before the group. They get that time to think about this. So they were like, we think you can. And we also had to just work hard with each other about our own anxieties. What if we try it and somebody is really upset, or it doesn't go the way that we thought? And just kind of had that supervision support to say, we're trying this for the right reasons. We've done everything we can to make it as safe as possible and to make people feel as supported as possible. And we really think that if it does work, we're going to be able to offer an awful lot more to a lot more people. So we just try it. We've just got to try it and see. And that initial hurdle, like going into the unknown and seeing.
Yeah.
So a huge amount of anxiety for us as well, and responsibility for us, because ultimately we're in this because we want to help people. We want to get things right as best we can. So just kind of sticking with it and giving it a go was probably one of the biggest challenges as well.
Well, I'm so pleased you did, because it's obviously worked out so well and you're supporting so many people. It's fantastic. So just tell us a bit about the service that you offer now to fathers and partners, which you just touched on briefly a minute ago. How was that developed?
So one of the challenges is sort of links to the other question as well, but one of the challenges is that services are commissioned for the woman or the birthing person only. So perinatal, it's woman and birthing person and the baby, and in maternal, it's the woman or birthing person only. Not commissioned for the partner, whoever that is, whether that's just non-birthing parent or a dad or partner, whoever it is. But we're not commissioned to directly work with them. So that's always been a challenge. It continues to be a challenge in services, continues to be something that across the country, lots of us are trying to work on, because we know that partners also experience distress and challenges after losing a baby or a pregnancy. So we've worked really hard to think about, okay, within the remit of our service and within the capacity, what could we do to support these people? And again, we managed to set up a couple of listening events to talk to fathers, partners, non-birthing parents about their experience of our service, and say, actually, you know, if we could do something, what might that look like? There's a huge and we're still working on that. We're still trying to work to develop that, but a huge diverse kind of range of ideas of what people might like. But what we did find very, very clearly is that they do not want a leaflet. That was very clear, certainly amongst the dads in the group. They don't want to be given a leaflet. And there was dads who felt like that was all they got. You know, it was maybe a leaflet or a direction to a website or something. And that wasn't helpful for them. They needed some kind of, I'm going to say, human interaction or contact to actually learn anything or take this information on board. They said that if it's just given to them, they don't take it on board. They want somebody to talk to them about it and hear what they're saying. So we were running the loss group, maternal loss group already. And we said, well, what about if we delivered a version of that? And our thinking behind that was that it gives often it's also the birthing partner, they're going to be with this person when they give birth. So it gives them a bit of information actually about what their loved one has been doing in that group so that they can support them. So some of our partners that are interested in this just want to come to support their loved one that's going to be giving birth. They just want to learn what they've learned, know a bit about that. But it also gave us the opportunity to, I guess, to give those partners a bit of information that might be relevant to them as well. What is complex grief? What is PTSD? What is depression? When might you want to access some more help? And also gave us the ability to tell them what is around, what is available within the local area, and kind of match them up with what's there if we can. So we wrote the group. We started to advertise it. We started to talk to the partners about it, and we booked it in and all of those things. And we offered it for about a year, not like every month, but say, you know, a few times throughout the year, and nobody came.
Right. Okay.
So we were, okay, nobody's come. What's that about? It's really hard to find out what it's about as well, unless you've got somebody to go back and ask. But often if they don't come, people don't want you to go back and ask them why. So we were just thinking, we don't know why they haven't come. We thought that this was something that they wanted, and we don't know why. So again, we just persevered with it. And we spent a bit more time talking to partners in assessments about what this was. And we spent a bit more time talking to the women and the birthing people that we were working with and telling them a bit about it and what it was. And people started coming. In the last 6 months, people have started coming. So this is a real achievement for us. Our trainee worked on this, been brilliant. And we're now starting to see, you know, and hear a bit more of the partner's experience, and they like it. They're recommending it. They're giving good feedback on it. So we're hoping that that will help it to grow, because across the services, the best recommendation is from people who've accessed the services. You know, we can go and tell people that we think we're doing a good job, but it's far more effective if they hear from a woman who's been through our pathway and says, yeah, it really helped me, or a dad or a partner who says, actually, yeah, that group was quite good. And that's far more effective. So we're hoping that we're going to see this fathers and partners group grow and grow and grow.
Well done. Well done for persevering. It sounds fantastic, because you're right, you know, everybody needs support, the whole family needs support. So that just sounds absolutely brilliant. So what other changes are you working on at the moment to improve support, if that's even possible?
Well, I think it's always possible to improve. Um, so our antenatal passport is quite new. That's only come in quite recently. So that's been a recent change and expansion. We also offer trauma-informed birth preparation to our families, and we're trying to work much more closely with obstetrics, gynecology, and fertility services in our local hospitals to again just really join up the communication across pathways for the families that we're working with, and we do that with multiple hospitals. Sometimes people birth in hospitals outside the county and things like that. So just trying to improve our working relationships with those services. Also doing some sort of cross-service training and education. So they're going to come and work with us, particularly around termination for medical reasons and IVF. We want to expand our knowledge in those areas, and we're going to go and speak with them and work with them about psychological interventions for complex grief and the kind of things that we can do to support families. We also do every year Baby Loss Awareness Week. We tend to do an event for that, so that will be coming up again, and we're going to be doing a couple of events for that. We tend to do an online teaching event that people can join and try and include as many sort of colleagues as possible. We also do a lot of working with third sector, and we're inviting them to come so that we can again be really trying to raise awareness of the fact that we exist. And even if we're not the right service for you, or we're not the service that you need, our aim is to try and help you find the service that you do need or you do want and link people up. I would never want anyone going away feeling that there wasn't anything available for them. Sometimes we would like there to be more available, but there are things available, and our job is partly matching up what people need with what is out there. And we're always trying to expand our knowledge of that. We're also working a lot this year on fathers and partners development. So we're in the process of building a bigger lived experience network. And we've just done some evaluation of staff experiences of working with fathers and partners and what's available and what that's like for staff. And we're looking to expand that even further and again get a better understanding of what they would like, in the hope in the long term that we might be able to shape services differently so that we could offer a bit more to those groups. But the first bit is always evidencing that. And also, I think just starting to build our lived experience network more. So for those that attended the conference, and I'll probably share a bit more about it, hearing the people that we've worked with speak about what we've done. And we've now been running long enough that we've got people that will come and speak and work with us and share their experiences, and that's really, really powerful. So we're wanting to expand that even more. Again, just about getting the awareness out there for a whole range of things. Some things that people feel that perhaps they can't access a service for, or they shouldn't access a service for. But absolutely you can. Absolutely you can access services.
Definitely. Gosh, well, you're doing so much, and I just want to say a huge thank you to you guys, personally, because I've been there. I've been through, a stillbirth. I've been through pregnancy after loss, and I just wish your service was available for when I went through it, because it would have made such a massive difference, especially to be able to meet other people, knowing that they're going through the same thing, at the same time as you, and just that the staff understand, the staff are walking with you on this journey. You're not alone. So yeah, I just want to say thank you for everything you're doing, because it's just absolutely fantastic. When I heard you at the conference, honestly, you just blew my mind, and I was like, we have to raise awareness of this for other trusts so that if they need inspiring to improve their services, if they've got challenges, they can hear from you. So this is just fantastic. I'm just wondering if there is an expectant parent that's listening right now, and they're looking for their own support following a loss, what would you like them to know?
Well, I was thinking about this, and I was thinking from my perspective, I just want them to know that we're here and that you can access us and that is okay. I would hope that would be enough for people to start to reach out. But I also took a couple of written comments from people who'd been through our service. So I was going to share those. So one lady said, "I'd want other parents to know that it's a safe group, can help you realise you're not alone and it's okay to feel how you feel. And it's worth attending as there's no pressure, but it can give you support or resources that you might not have thought about." And I think that's been the main feedback from our families is you might not get anything out of the group. You might come and think, actually, that wasn't for me. I didn't learn anything new. But what people consistently say is they always felt they didn't have anything to lose by trying and coming. And actually, most people do come away from the group with something that they didn't know or a strategy that they can use that they wouldn't have tried. Or just a feeling that there are other people out there sharing those experiences. So one of our ladies who actually spoke at the conference saw a video, her feedback was just do it, just come and try. And we will do everything we can to make that process as easy and as helpful as possible. So even if you are somebody who this is going to be really, really difficult for you to reach out, that's okay. We will take the time. We'll spend that with you. You don't have to go straight into the group. There's lots of ways in which we can work with anyone who needs it so that you don't have to be alone.
It's fantastic. And how can people contact you? So if there is someone pregnant and they're thinking, oh yes, actually I would quite like to access this service, or if it's another healthcare professional from another trust, for example, that would love to pick your brains on something, how can people get in contact?
So if you go online and you Google us, Maternal Loss Psychology Northampton, our website will come up. All of the contact details are on there on the main trust website. There's also some videos across our service and our perinatal team that you can watch. And the referral link is on there. The contact details for the service is on there. So anybody wanting to get in touch, please do. We're very happy to talk to you. We're very happy to share resources with other trusts. We had quite a lot of people get in touch like yourself off the back of the presentation. So yeah, if you Google us, you'll find it.
Wonderful. Well, thank you so much for giving us your time today, Kirsty. It's been absolutely wonderful. And yeah, I just wish you all the best with the service.
Thanks very much. Thank you.
If you enjoyed listening to this episode, share it with a friend or colleague. Make sure you follow us so you don't miss out on our next episode. If you'd like to support our work by fundraising or volunteering, please email contact@mamaacademy.org.uk. For more information on pregnancy and maternity services, please visit our website at www.mamaacademy.org.uk. We're also on all of your favourite social media channels. See you next time!